So for our next presentation that we're really excited about, we're excited to have Stephen Smith here, who's the the Deputy Commissioner and Director of TennCare, Tennessee's Medicaid program. And in his current role, Stephen manages a $13 billion healthcare enterprise that provides services to over 1.5 million Tennesseans. So it's crucial and very important topic for us today. But before being appointed as the director by Governor Bill Lee, Mr. Smith served as the Deputy Director and Chief of Staff of TennCare. And prior to joining TennCare, he had served as the Chief of Staff to Governor Bill Haslam, where he oversaw the day-to-day operations in the governor's office and was a top strategist there. He also has previously served as the Deputy Commissioner for Policy and External Affairs at the Tennessee Department of Education. He's also a licensed attorney and lives in Nashville with his wife, Christina, and his 3 younger daughters. So we're so excited to have you here, Stephen. And without further ado, I'll turn it over to you.
Okay, thank you so much, Jacqueline, and all of you. It's great to be with you this morning, and I appreciate the opportunity to be part of this virtual conference. And before I start, you mentioned my 3 kids. I need to let you all know that I am at home, and I have 3 little girls, and they are also at home. And as I'm sure many of you know all too well, kids somehow know the very worst times to start screaming and fighting or complaining. And so if you all hear that, I'm going to go ahead and ask for a little grace. I do think that within all of the pain and the challenges that have come with the pandemic, one of the positive things has been that we are all a little more relatable. We all have a little more patience with and empathy for each other. And those things, I believe, can be sustainable and carry through even post-pandemic. And at least I hope that is the case. At the onset here, I want to commend the Tennessee Healthcare Campaign for your work and your vision. That vision of all Tennesseans having affordable, high quality, and equitable healthcare. That is a worthy vision. It's not dissimilar from the mission of TennCare, which is to improve lives through high quality, cost-effective care. And I had the opportunity to sit down with Judy a couple of months ago, and we talked about your vision and our mission at TennCare and how we can work together toward common goals. And it was that conversation that was actually the genesis for me being with you all today. Now, I'm not naive, and neither are you. We're not going to agree on everything. Our positions may diverge from time on some of the specifics, but I do think we can agree on the basic concept that Tennesseans should have access to affordable, high quality care. And in fact, Governor Lee has talked about this very thing. When I'm talking to groups, either internally or externally, I always try to center on our mission. And again, that's to improve lives through high quality, cost effective care. Because as a state Medicaid agency, we have to address both of those pieces, both the high quality piece, the access piece, and also the cost effective piece. Sometimes I think there is an accepted narrative that cost containment or the cost effectiveness piece must, by definition, translate to a reduction in quality or access. And that is simply not the case. We've proven as a state that the cost containment and quality improvements go hand in hand and are actually dependent on each other. Controlling costs, coordinating care, properly managing utilization through effective and appropriate measures means that you can actually provide more services and serve more people, and you can do it without breaking the state budget. And the budget piece is a very real concern. We've come a long way in our TennCare program, but the truth is it wasn't that long ago when double-digit growth trends and runaway costs threatened the very existence of TennCare. And in fact, projections showed that the TennCare budget was going to take basically every available new state revenue dollar. And so clearly that was not sustainable. And so the executive branch and the legislative branch at the time took major steps in 2004 to reform the program. And some of those steps were very painful and very challenging. And I know many of you remember them. And no one wants to be in that position again. And I bring that up because sometimes people will say to me that, well, if you all really lived by your mission, then you would cover more people, you would cover more things, and you would pay more for those things. But the reality is, of course, it's not that simple. It never is. And one of the reasons why it's not simple is because of the impact that the TennCare budget has on the overall state budget. In fact, TennCare makes up about a third of Tennessee's budget. And what that means then is that if we are unable to control costs to a reasonable level, there won't be any funds left for other state priorities. And I'll give you a really concrete illustration of this. So since the year 2000, Tennessee has outperformed every single state in the nation when it comes to limiting the growth of the share budget that supports Medicaid. And this is something that we're proud of, and we are able to do this, of course, because we've controlled our trend or our year-over-year growth. But if our trend rate had simply been at the Medicaid average across the nation, not lower, but just at the average, over the last 10 years, we would have spent an additional $2 billion to run our program. And so that, again, that's just if we had performed just at the average Medicaid program growth trend level, $2 billion more. Coincidentally, that's very, very close to the same record amount that the state has increased K through 12 education funding over the past decade. So what that means is if we don't do a good job of controlling the rising cost of healthcare within TennCare, those education improvements, they just don't happen. So if we look back over the past and then we think about ahead, going forward over the next 10 years, it doesn't take a rocket scientist to figure out that if we go back to those days of double-digit trends, it won't be the education funds that get cut. It will almost certainly mean no additional education funding, but probably not cuts to education. Instead, what it will mean are cuts to the largest chunk of the state budget, and that's Medicaid and TennCare. And that's what we all want to avoid. So we can be proud as a state that we've avoided those cuts, and we've done it through sound fiscal management, that cost-effective care piece. But we can also be equally proud that we have not done it on the backs of access or quality. And in fact, we've increased access and we've made great strides on quality. Most recently, that has translated into something that I know that the healthcare campaign has worked very hard to accomplish, and that is extending benefits to postpartum women from 60 days to 12 months. And in addition, we've been able to add dental benefits to that package. So we have a major focus on maternal health, which of course is also about infant and child health. We've also made investments in trying to tackle social determinants of health through a closed loop referral system. We got funding in this year's budget for this closed loop referral system, which is designed to connect TennCare members with social needs, things like food insecurities, shelter needs, transportation needs, things that we know play a huge role in health and thus healthcare costs. We're trying to make that connection to people with those needs with available community resources. And the funding that we received for this closed loop referral system is going to help us to do that. Also recently, through the Katie Beckett program, we have extended benefits to children with very complex conditions and needs who don't qualify for Medicaid due to their parents or their caregivers' income. This is a really exciting program. It's a program that will improve lives. It will change the trajectory for children and families, and it literally will be a lifesaver. On the quality side, we've been able to invest resources into care coordination activities that are showing some real significant returns. For example, childhood immunizations and screenings were up pre-pandemic. Now we know we've taken a dip during that pandemic, and we're starting to come out of that, but we saw some really positive results prior to the pandemic. Our neonatal abstinence syndrome births are down significantly. In fact, Tennessee is the only state in the country that is reporting continued decline in these births over the last 3 years. That, of course, is due in large part to the collective work around the state, around the opioid epidemic, we've seen a sharp decline in the number of pills dispensed and an increase in the number of TennCare members receiving medication-assisted treatment to help them with opioid addiction. We've also made great strides in our long-term care supports, with many TennCare members being served within their homes and their communities rather than an institution. And that's a really big win for everyone because it allows us to serve more people in the setting where they want to be served. And it also allows them to live their lives as independently as possible. This in turn results in considerable cost savings, which can then be reinvested back into the program to serve more people. And on a related note to long-term services and supports, we have prioritized serving more individuals with disabilities that are waiting to receive services through our employment and community first choices program, as well as addressing the wages of those frontline workers or the direct service providers who do such critical work in this field. And you can, in our recently submitted plan to the federal government, we have proposed to utilize one-time ARP dollars. These are the large federal dollars that are available to states for specific purposes. We've proposed to the federal government to use those dollars for these very things, to take people off that waiting list, to wages for those individuals serving that population. So we want to double down on these efforts. We want to double down on maternal health. We want to double down on attacking social determinants of health. We want to double down on addressing the waiting list for services for people with intellectual and developmental disabilities. And we want to double down on our efforts to address opioid misuse. But the question always is, well, how do we do that with so many competing state priorities and limited recurring funding? And we believe that we have a way to get there. And that's what I want to spend the most of the rest of my time talking with you about. And specifically, I want to talk about our TennCare 3 waiver, which was approved by the federal government earlier this year. And this of course has gotten a lot of attention, and I recognize that this waiver is not without controversy. I understand that. I understand why some of the things that had been put out there by some people and some groups, I understand why those things cause concern. For me, it's really important that you all have a good understanding of what this waiver agreement is and what it is not. I know that this term block grant, it conjures up a lot of strong opinions and a lot of assumptions, but the titles that we give these things are far less important than what they actually do. And I think that's where our focus should be. Unfortunately, there are many groups and individuals out there who are misrepresenting the facts about what this waiver is and what it is not. And I think there are a couple of reasons for that. Either one, because they just don't understand what the facts are, or because they are, quite frankly, choosing to ignore the facts. And that wasn't unexpected, but it is disappointing to us nonetheless. But it's my job to clarify those facts and for the people that we serve and the stakeholders that we work with. And if you all watched any of the legislative on this topic and on this waiver earlier this year, you get a lot of what I'll say now, but there are a few points to be sure to make. I want to be very clear that this agreement's not based on, it's not based at all on the state spending less money in its Medicaid program. There are no cuts to eligibility. There are no reductions in benefits. There are no reductions to services and no reductions to what we pay our providers. We've been operating under this waiver now for more than 8 months, and there has not been one cut. In fact, it's just the opposite. For the first time, we are going to have the real opportunity to be rewarded for our efficiency and our sound management of the Medicaid program. And that reward comes through additional federal dollars that are known as shared savings. And then the goal is we're going to reinvest those funds in areas that will enhance the TennCare program and the benefits and services that we provide to TennCare members. Those things we talked about earlier, where we said we want to double down. So this is our way to do that. It's about more, it's not about less. I do understand that people have a hard time understanding and achieve shared savings or additional federal funding without making cuts to our program. But that is not what this is about. If we can mirror our historical performance and do what we've always done, which is be efficient and effective, then we will achieve shared savings. And that's the beauty of this plan and this agreement. So if you all don't hear anything else from me today about this waiver, please hear me say that our success on this is not based on cuts. We do not have to cut to receive shared savings. If that were true, we would not have proposed funding improvements for this current fiscal year. And then near the end of this year, you are going to see us propose investments for FY23 to the governor. And so if this narrative that we have to cut in order to be successful with our waiver were true, we wouldn't be asking for increases. In fact, it would be just the opposite. Second, when we talk about our spending cap, this is not a fixed cap, and therefore it's not a traditional block grant. Some have called it a modified block grant. In fact, the federal government doesn't use the term block grant at all. Our cap is trended forward with a very favorable trend rate. It's also adjusted for enrollment growth. When you think about what a block grant really is, it doesn't include either of those things. It doesn't include that trend adjustment, and it does not include an adjustment for enrollment growth. Our waiver has both of those things. Furthermore, we have other built-in protections, including carry forward savings that will serve as a safety valve in the event that we go beyond our cap. Third, this agreement only enhances our program's commitment to quality and access by conditioning the shared savings opportunities on maintaining and improving in key quality metrics. So we had to propose 10 quality metrics to the federal government, and in order to receive shared savings, we have to meet or exceed those metrics. So there's absolutely no incentive at all to cut costs by impacting quality and access. Fourth, it's really important to note that all 1115 Medicaid waivers have a spending cap. That was true before this waiver, and it's true for us after. The truth is that we are in a better position with this waiver in that we have a higher cap than we would otherwise have. So all that to say, this waiver is really good for Tennessee. I wish we could take the politics out of it. I really do. I understand that sometimes that's just not possible. But at the end of the day, it's about improving health, which then drives down healthcare costs, which then results in shared savings, which then results in a reinvestment of those savings back into our program to improve health. And then starts all over again. For all those that have been pushing the federal government to rescind this waiver, I always come back to the same question, and that is, well, what is the plan B? Because all of the same risks will remain. The only thing that will disappear is the reward. And I don't know why we would want to take that away, because it is a tremendous opportunity for Tennessee and TennCare to do some things that we otherwise would not be able to do. So if anyone listening today is skeptical, I understand. I really do. And all of that I would ask is that you give us a chance to do exactly what we say we are going to do, and then judge us after that. And that would be more than fair. Lastly, because I want to make sure I leave plenty of time for questions and comments, I want to talk about COVID and the impact of COVID on Medicaid programs throughout the country and specifically here in Tennessee. And I want to talk about a way that we can work together to address a challenge that we are going to face in the very near future. So during the pandemic, our enrollment has grown significantly. We are up about 13% or 185,000 members. And that number is going to grow as we complete the year. And the enrollment growth is due primarily to the fact that during the federal emergency, we are prohibited from removing one from the TennCare rolls, regardless of eligibility. So our required annual eligibility redeterminations have been paused, and they've been paused for quite some time. Well, when the emergency ends, of course, those redeterminations will start again pursuant to federal and state law and requirements. So we at TennCare, we plan on conducting an extensive outreach prior to resuming these renewals, but and we have to do that because we simply can't maintain enrollment on the program unless we are provided with documentation from individuals that confirm that eligibility. The good news is that it is easier than ever before for TennCare members to engage in that process. We have increased the ways that individuals can apply and renew their memberships. And our TennCare Connect system is a big driver of that, where members can submit and verify all of their information electronically. And there's a dual responsibility here. It is a responsibility of TennCare members to provide information that is requested and legally required, but it is our responsibility at TennCare to make that process as user-friendly and easy as possible. And that is what we are trying to do. But we need your help. We need your help with the outreach piece. We are asking you to help us to let people know this is happening. The truth is, we do not want eligible individuals entering and leaving and then coming back on TennCare only to leave again and then coming back. This is something that's called churn. It's an issue that every Medicaid program in the country deals with, but that benefits no one. It certainly doesn't benefit the member. It does not benefit the Medicaid program either, because it interrupts that continuity of care. And at the end of the day, it impacts health and it impacts healthcare costs. And so I think we have a common, goal there that we can work together to address. Okay, I have done a lot of talking, and I'm going to stop there. I want to leave plenty of time to get to the things that you all want to talk about, to answer questions, and to hear your concerns. And again, I just really appreciate the opportunity to be here. I appreciate the invitation.
Well, thank you so much, Stephen. That's definitely been enlightening, and we do have several questions for you. So first, I think I'm going to start with a question about redetermination. So when the pause on redeterminations ends, what is TennCare's plan for how you will reach out to, well, what is your plan for how to move forward with those redeterminations? We'll start with that first.
Yeah, so we're still waiting to get final guidance from the federal government about some of the specifics there, but what we have been told is that we are going to have 12 months. We'll have a 12-month period to do all of those redeterminations, which is good news because previously it was 6 months. And so, and that was going to be extremely difficult to accomplish. And so it's good news that they've moved from 6 months to 12 months, but we're still awaiting the final guidance there. And so we're going to have a campaign. We're going to work very extensively with our managed care organizations to make those contacts with individuals. We're going to work with advocacy organizations as well to get the word out. We're going to have a digital campaign so that everyone that has registered with us online will be able to push out those messages through text messages, email, and we're really trying to, with our TennCare Connect system, we're really trying to get people to give us their information, their email address, their cell phone numbers, so that we can push out that information very easily. And so that if they move their physical address, they're not going to miss something in the mail.
Well, thank you so much. And another follow-up on that redeterminations piece that comes from Andrew Hawkins, who's worked with THCC for a long time. He mentioned that in the chat, he's personally assisted maybe over 1,500 people with applying and being enrolled in TennCare, helping them troubleshoot issues around their account and appeals and that sort of thing, especially for folks in smaller counties with smaller health departments. And he wonders, you didn't mention advocacy organizations as far as support with those redeterminations. Are there other nonprofit organizations that you all do have a plan to reach out to already to assist with that redetermination process? And will there be potentially any funding for nonprofit organizations to help assist you all with that?
Yeah, that's a great question. We are having some discussions about funding opportunities where we could work with some of these nonprofit organizations. So stay tuned on that. Of course, we also will work with our Department of Human Services that has a lot of connections with some of these agencies as well to see if there are opportunities there. But yeah, I think that's a really good point and something that we are exploring.
Okay, great. And then there are a few questions about TennCare 3 waiver. So thinking about that waiver, does the TennCare 3 waiver cap future federal contributions to TennCare cost?
It does not. And well, what I would say is it doesn't cap it any more than what our cap would be previously. There's nothing about this waiver that changes our cap. We had a cap before, and we have a cap now. The cap is trended forward. This gets kind of in the weeds, but it's trended forward using the trend rate that's in the president's budget, which is a very favorable trend rate for us when you look at our past experience. And then it's also adjusted for enrollment increases. And so we feel like we have a lot of protections in place. The other thing that's really important to note is I talked about that carry forward savings that we have that travel with our old waiver into this new waiver, and that's for a 10-year period. It's a total of $6 billion. And so in the event that we were to go above our cap, which we feel very confident we will not, but even if we did, we would have that $6 billion to fall back on. It's kind of like a safety net. So we're going to be just fine. There's not going to be a scenario where we've hit some level where we're not going to be able to draw down additional federal dollars.
Okay, and do you know if there's any risk or possibility for that Plan B to be rescinded at all?
Well, that's a good question. I mean, we've had good conversations with the Biden administration, with the new leadership at CMS, but I can't predict what they may or may not do. There's also a lawsuit that is pending on this, where Tennessee was not sued, but CMS was sued by some plaintiffs here in Tennessee. And so I can't predict how all of that will play out. That's in advance right now, as CMS held another 30-day public comment period. But it's hard for me to predict what CMS may or may not do. I'm very hopeful. I'm very optimistic that we are going to be able to keep the waiver, and we're going to be able to do some really good things with it. And I also think that many of the priorities that we have, the things that we want to do, align very well with the priorities of the federal government. And so I'm hopeful and I'm optimistic that we're going to be able to work through this and show some real results.
Okay, excellent. And we do have a few questions around just some eligibility and vaccine related things. So does TennCare collect any data on the number of TennCare members who have already been vaccinated versus not vaccinated? Do you all have any data on that for TennCare members?
Well, so we do have data on the number of vaccines that have been provided through TennCare reimbursement, but we don't know that. That's very different from the total number of Medicaid members that have received the vaccine. Because Medicaid members, TennCare members that have gotten the vaccine through other means. Some of these, anyone can go and get a vaccine from certain sites, and so that doesn't end up as a claim to Medicaid, and so we don't pay for that, and we don't have the record of that, and so we do have numbers on the claims that we have paid for vaccines, but we know that we have many more Medicaid members that have gotten the vaccine than what that number would be.
Okay, and One of our attendees is wondering how many people, or do you know how many people are currently eligible for TennCare but not enrolled? So what that gap is. And similarly, even with the Katie Beckett waiver, are there any plans for outreach to individuals, parents, families, to make them more aware of those opportunities?
Yeah, I don't know. I don't know the numbers of individuals who are eligible today for TennCare that are not on TennCare. Um, and then in terms of outreach, there's a lot of outreach that happens over the open enrollment period. And part of that is when individuals apply for insurance through the exchange at the federal level, that application will identify if they are eligible for Medicaid, and if they are, of course, then it comes over to us. So we always see an uptick during that open enrollment period. I know there's been a lot of outreach at the federal level about these open enrollment periods.
Okay, well, great. Thank you for answering those questions about eligibility. There is another question in the chat, and then also I'll kind of mesh these together, these last two questions. One about where do things stand on drug formulary adjustments, and another specific question was around savings around prescription drugs. Can you speak to that at all, and how you are, what's the plans around that, and even thinking about communities that might be most impacted by that savings? Will you share a little bit with us about that?
Sure. I think that question is coming because in our waiver, we did get the flexibility to make adjustments to our formulary. And this is very similar to the flexibility that the Medicare program has, and the tools that the Medicare program has. And also, of course, private insurance has these flexibilities. So we ask for the flexibility. We think it makes sense. But one thing that we've always said is, one, we're not going to make any adjustments to the formulary for children. So this would only apply to adults. And then two, we will have a process in place where if the physician and the patient, the TennCare member, determine that a particular drug is necessary and it's not on the formulary, then there would be a process in place where there could be an appeal, and if it's deemed to be medically necessary, we would cover it. So those are two protections I want to point out. We have not. We've said we're going to be very careful with this. We're going to take our time. We're going to study this and analyze it to see if it really makes sense for Tennessee and our program. And so we're still in the very early stages of looking at that. But I do think that it is a tool that Medicaid programs should have, because pharmacy costs are a huge driver of expenses. And I'll just use the example of the recently approved Alzheimer's drug, Aduhelm, which is getting a lot of attention. This is an extremely expensive drug. There's been some controversy with this drug. The FDA approved it, but you may have read that the committee that makes recommendations to the FDA did not recommend this drug, and it really was not even close. And you had a lot of these committee members that resigned over this. And so there's been a lot of controversy about this. The way Medicaid works, if it's approved by the FDA, we have to cover it. However, Medicare, and remember, most of the individuals that will be prescribed this drug will be Medicare members. Medicare has not made a decision whether it's going to cover this drug or not. And if Medicare does not cover this drug, it's Medicaid that has to cover it, which would be a massive, massive cost on the part of Medicaid programs and state governments throughout the country. So these things have real impacts. And to me, I don't understand. These are both federal programs ultimately. I don't understand why we would say Medicare has these tools in place, but we're not going to give these same tools to Medicaid. But we're going to be very careful about how we approach this, and we're going to make decisions that are in the best interest of our program, but also the people that we serve. And one thing I do want to repeat is, if there is a specific drug that a TennCare member needs and the physician deems that necessary and it's medically necessary, we are going to cover it.
Well, thank you so much. I think we have time for maybe one or two more questions. And one question that we want to be sure to ask is that if folks are seeking out information about TennCare or even wanting to give feedback, what are any processes that you all have where individuals who are maybe concerned about issues with TennCare, what are any processes that are in place for feedback to be given around TennCare?
Yeah, sure. I think we work, of course, with a lot of the advocacy organizations. We hear from advocacy organizations all of the time. We have a group of advocacy organizations that we meet with on a quarterly basis. And so that is one opportunity, and we could get you all a list of those groups. Also, we have direct lines that are available through phone lines, but also through email, and those are available on our website. We have social media accounts where people are not shy about sharing issues that they are having, and we monitor those very closely. And sometimes we will see someone will post something on Twitter. Maybe they have a complaint or they're having some issue with TennCare, and we will respond directly based on what we see on Twitter or a Facebook account. So we monitor those, and we try to outreach and respond to those where we can help.
Okay, great. Well, I just want to say thank you so much, Stephen. We appreciate you for joining on this morning, even though we know you had other commitments with your family and everything. So we appreciate this time. We appreciate you coming on and just speaking to some of the updates about TennCare. So thank you so much.
Yeah, absolutely. Thank you all. Have a great rest of the conference.
Thank you.